Monday Health Minutes, sponsored by Valley Health.
I'm Melanie Schaefer. This is Valley Health Minutes. You might be shocked to find out that about 40% of Americans are considered overweight or even obese. It is surprising to me, I know that. And we are talking with Dr. Michael Amos today about how you identify if that's you and what kind of help there is available. That number is shocking.
Very much so, yes. When I was looking over some of the facts and statistics for us, it was huge to see that so many Americans are afflicted. That's almost 120 million Americans are overweight or obese.
So let's talk about the definition of that, because I think that's where people get hung up. You think you could just tell, but it's a lot closer than you might imagine. That's why a lot of people are in this category.
Yes, it really is. Sometimes you can look at weight as just 20 pounds overweight, or is going to be setting you back significantly and putting you in a category of overweight or obese. But
now you're talking 20 pounds over your ideal weight.
Yes.
Okay.
And so what we look at as a standard bearer is the BMI, body mass index. It takes into account height and weight and gives us a calculation for quantifying if you are overweight or obese. And so that's the standard that's been used for many, many years to help identify those that then are more at risk for things like diabetes, heart disease, high blood pressure. And so all of these things kind of go together.
Things you need to watch out for. A lot of people have tried, of course, in the past. You know, how many New Year's resolutions have there been where this is the year?
Yes.
So what if you have had struggles in the past? How do you try to approach weight loss and weight management differently?
And so I think that it's a multifaceted approach, that we want to work to treat obesity as a chronic condition. It's not a fad. It's not the diet that you go for a month and then off of it. It really is a lifestyle change, and then medications that have been deployed to get you down and to also help you in the long term to help care for you chronically.
So let's talk some medications. I know the commercials are all over the airways these days about different medications that can help you lose weight and keep it off. What are your options?
So it's an exciting time in medicine and the care of obesity. It is now becoming more closely tied for a medication that you could even inject once a week to result in the equal weight loss to that of bariatric surgery. Some trials now are already showing that we could obtain that, which generally is regarded about a quarter of your body weight is what bariatric surgery would help you pull off. But now we have medications that are getting into the low 20s and the percent body weight lost.
Yeah, without the dramatic effects of surgery and the possible complications from it too.
Most definitely.
So talk to me about, what about side effects for these medications? What should people consider before they think this is for me?
And so generally it's best to start with an evaluation by a physician that is doing a lot of obesity management, or even obesity clinics that are located around the state. What they kind of look for in that is those that have suffered from conditions that would lead you to maybe be at higher risk for side effects. Some things, even as benign as kidney stones, could be increased with some of the treatments that we have for obesity. Outside of that, though, medicines that we've seen over the airwaves recently would likely be tied most to nausea and vomiting, and some GI upset is most common.
Okay. What are the success rates of these kind of medications and different treatments for obesity?
Yes, so we're still looking at a lot of things in the longer term. There's been some studies on these medications. Brand names would include Wegovy, Ozempic, Mounjaro, from various manufacturers across the country. And the studies are still ongoing to look at how we really address obesity. As I said, it's a chronic condition, and so trying to talk with patients about how long we need to be on these medicines, what weight loss we could assume to see, is an ever-changing discussion that I think is going to keep being based on the science coming out. Currently, though, as I said, we could have up to 20% weight loss, and then you would probably need to be transitioned onto these medicines in a more long-term spectrum of care.
Interesting. So do you need a referral to talk to a Valley physician about this?
Of course not. And so Valley Health is open and very accessible to our patients. And so physicians in Valley Health from even different specialties are working to help curb the epidemic of obesity. I know in my practice, I'm a primary care physician and I treat obesity out of my clinic in Westmoreland. And so it really is different providers across the system working to put folks on these medications that can help curb the epidemic.
So many millions of people that could benefit.
Most definitely.
Dr. Amos, thank you so much. Some great information.
Thank you.
Very interesting. Thanks for being here for Valley Health Minutes. We'll see you next week.